And welcome back. Now, October marks a Breast Cancer Awareness Month, and men are also affected with a lifetime risk of 1 in 25. Breast cancer is the most frequently diagnosed cancer in South Africa. Although rare, 1 to 3% of all breast cancers occur in men, and they too are encouraged to self-examine, especially if breast cancer is common in the family. The Breast Imaging Society of South Africa, a sub-speciality group of the Radiological Society of South Africa, urges everyone to regularly self-examine one's breasts and not to wait for a partner or medical professional to discover a lump or changes in the breast. Regular breast self-examination and breast screening with mammograms are essential to ensure the greatest chance of survival from breast cancer, they say, which accounts for more than 25% of new cancer cases in South African women in 2020 and 8% of cancer deaths. Right, let's speak a little bit more about this to incoming Secretary of Breast Imaging Society of South Africa, Dr. Aadila Mehtar. A very good evening to you, and thank you so much for speaking to us. I know this sounds like a pedestrian question, but let's first start with, what is breast cancer?
Hi, good evening, and thank you for having me. Good evening to your viewers. So breast cancer, what is breast cancer? So normally, breast cancer is a disease whereby the cells of the breast divide uncontrollably and they grow abnormally and they become tumors. So normally what happens, normal cells, when they get old, they die and undergo destruction in a very controlled manner. But when this happens in an uncontrolled manner and the cells start dividing profusely, then that's when we get what we know as breast cancer.
I mean, we just read a slew of figures there, but in the South African context, is it mostly men or equally? I mean, is it mostly women or men? Is it equally? Just give us a sense of how each of the genders is affected.
Okay, so in the year 2020, about 25% of all breast cancers were found in women in South Africa, and 8% of all cancer-related deaths were due to breast cancer. So with a lifetime risk of 1 in 25, breast cancer remains the most frequently diagnosed cancer in women in South Africa. Although rare, 1 to 3% of cancers occur in men, and this is more common if they have a family history of breast cancer.
And we spoke about detection earlier on. When is an ideal time to start checking? And does it from men to women?
So it is important to familiarize oneself with your breasts so that you know what normal is and what changes will happen. So what's normal, and when there is something that changes, whether it's a lump or whether there's slight asymmetry or contour deformities, then you are able to detect these changes and reach out for medical help. So in terms of
when is the ideal time to start checking? Yes.
The ideal time it would be when so the ideal time is when you.
Is there a particular age, perhaps?
The ideal time would be, perhaps the age. So yeah, the ideal time would be from the age of 40 to about the age of 70. But if you have a family history of breast cancer, then you should seek screening earlier.
And you should. You spoke about familiarizing yourself with your breast through self-examination. Obviously, biologically, men and women are different, and what is normal and what isn't normal wouldn't apply the same to both. So for women, what would you look out for? For men, what would you look out for? And especially if what we know is lymph nodes can be a bit confusing in self-examination.
Okay, so the signs and symptoms are the same for the same in men and women. The signs and symptoms that one should look out for is any changes in size, symmetry, if there's puckering of the breast, if the nipples are retracted and turned inwards, if there's a nipple discharge, if there's a lump under the armpit. So that's what you're talking about, the glands under the arms. And in particular, you should look around the collarbone area as well to see if there's any lumps there, as well as the chest bone.
Okay. Now, let's talk about types of breast cancer. Are there types? I mean, given the fact that we're speaking about breast cancer, one would assume that there is one type.
Okay, so breast cells, there are different types of cancers, and breast cancers, and the type of the breast cancer will depend on what type of breast cells. So the breast comprises of three different cells. The one is the lobules. This is the cells which make which produce the milk and stores them. And then we have the ducts, which are little tubes that transport the milk to the nipple. And then we have the connective tissue, which holds them all together. And that connective tissue is made up of fat and fibrous tissue. So depending on which cell is involved, you would have a different type of cancer.
And mammograms, how easily available and affordable are they? I mean, it's easy to say, make sure you get an annual mammogram, but is it easy to get one?
So previously it was difficult, but with great initiatives like the Pink Drive campaign and Cancer and all of the wonderful organizations that are doing such great work in ensuring that all women are allowed, the reach is greater, that they are reaching those areas where health services do not usually go to, in rural, impoverished areas, and provide the education and screening that those women deserve. So there has been, and with Breast Cancer October month, with the awareness, there have been many different initiatives from different practices also in South Africa. We encourage the private radiological practices do give discounts during this month, and they also run incredible competitions and giveaways of free mammograms to those who are unable to afford it ordinarily.
And getting a diagnosis of breast cancer, tell us about the various stages. I'd imagine just even hearing the word cancer is enough to scare anyone into thinking that they ought to panic.
So the cancer stage depends on the size and the location of the disease. So for instance, if the lump is confined to a small area of the breast, just a small area, then it will be in the early stage, and it depends on the size of the lesion. As the tumor progresses, it becomes larger and it occupies a larger portion of the breast. Eventually, it involves the skin, it involves the chest wall, and it involves the glands of the armpits and the different glands, and eventually then it spreads through the blood and through the lymphatics to other organs, and then eventually you can get metastases, which is spread to the brain, to lung, liver, and bone.
But it is treatable.
Cancer, there has been great advances in cancer therapy, and with these advances, one receives less aggressive and less invasive therapy, and it increases the chances of survival, but the premise still remains early detection through screening. That is of vital importance.
I saw some data saying that women of color are particularly more prone to high mortality rates in breast cancer. Why is that?
Due to mainly the risk, so genetics, so the most the contributing cause, the most pronounced contributing cause or the risk factor is genetics, whether you have certain genes in your DNA that predisposes you to cancer. So there's a BRCA gene that that is now found in these women of color that will now predispose them to cancer. There are other risk factors, for instance, advanced age. If perhaps lifestyle is also important, not bearing women until later in age, so until much later in life. So women are encouraged to seek mammograms if they don't have children before 30 and 40. So they should be screened and also they should be screened earlier.
All right, Dr. Aadila Mehtar, thank you very much for your time, just giving us some breast cancer education, as it is Breast Cancer Awareness Month.